Um, so I put this in here so it reminds me to start recording. So we are recording. So just as a warning of what information you're sharing will be posted to our website for other folks um, to check out afterwards if they weren't able to attend today's meeting. So we are recording. We have my whole team here, the workforce unit, and they are all monitoring the chat along with me. So use the chat if you have questions, if you're having issues, if you need anything. We will be posting the slides. There should be a link to them coming into the chat soon as a Google Doc, but they will be posted to the website afterwards as well, along with all of our presenter slides. If you're listening by phone, welcome. You are welcome to press *6 to unmute your line at any time or *9 to raise your hand if you have a comment or question. I did turn on closed captioning, so you should be able to turn those on or off on your menu bar on the bottom or top, depending on how your screen is set up. And any meeting information can be found on the Direct Care Workforce Collaborative website, which will be dropped into the chat as well here in just a few. And that's where you can find past meeting information, upcoming agendas, past recordings, and just any announcements in relation to the Direct Care Workforce Collaborative. So moving on, if you wouldn't mind, as I'm getting the polls queued up, writing your name, your location, and your role in the chat. So if you're, a provider, maybe what agency, just let folks know who's here today, coming through the chat. If you're on the phone and you'd like to report as an attendee, go ahead and hit *9 to raise your hand, and then *6 to unmute yourself to announce. So we'll let those trickle in slowly. And I'm going to go ahead and run some polls. This will just kind of level set for us, let us know who's here in the room today. And we also use this poll information in our action groups and our leadership team to identify maybe where we need to do some outreach. We love to be geographically diverse across the state. We want to have representation from each geographic region and also different individuals, different agencies, just across the whole continuum of direct care workers and those that support them. So I'm going to go ahead and launch some polls. The first one is going to be, what region do you represent? So you should see that on your screen now, and I'll give everyone about 30 seconds. All right, so I'm going to go ahead and end the poll. We have most of the folks that are here have participated, so go ahead and end poll. We do have representation from every region, which is really exciting. So thank you all for being here. Thanks for sharing the word of the collaborative and getting it out. Probably would help if I shared my results for you. So this is where we're having certainly some, some of the regions are a little less represented. So we'll certainly do some targeted outreach there, but just really excited to have folks from all over the state joining us today. We'll go ahead and go to the next poll question, which is how you identify or are connected to the direct care continuum. And again, we'll do about 30 seconds. All right, and that's about the same number that answered last time. So let me end that and share. So we do have good representation, a few direct care workers, individuals receiving services, and family members. Thank you and welcome. And then of course we have our employers, advocates, and our government agencies. So again, just some information on where we can do a little bit more outreach, getting our direct care workers to the table. And then finally, we like to know how you heard about us because you're here, you heard about us one way, and we want to see what the best way is to get the word out for future direct care workforce collaboratives. All right, go ahead in that and share. Oh, sorry. There we go. So most of us are coming from the HCPF newsletters or the communication. We see that in a lot of our action groups as well. So if you have information or you're interested in signing up for that newsletter, if you're not already on it, please let us know. We can certainly connect you to the right place because that's where a ton of the information is coming out. And then again, thank you employers, providers for referring individuals to this meeting. So with that, let's go ahead and roll to the next one. So I'm going to hand it off to our co-chair, Penny Whitney of the Direct Care Workforce Collaborative, to talk a little bit about why we're here and to also meet our leadership team. Penny?
Thanks, Brooke. Oh, let me please add my welcome to Brooks. Hard to believe that we are actually at the end of our second year of the Direct Care Workforce Collaborative. And just looking at those polls, thinking back to January, one of our goals for this year was to increase geographic and stakeholder diversity. We're doing that. We've got work that we can still do, but thank you for being here and thank you for continuing to communicate the important work that we do. I would like to just quickly, always purpose and vision, help ground any group that we're a part of. And for those of you that have been here since the beginning of the collaborative in 2020, those of you that have been here just beginning today, reinforcing why we're here and why we're doing the work we do continues to energize not only us individually, but the collaborative as a destination of resources for the state of Colorado. The Direct Care Workforce Collaborative is dedicated, notice the word dedicated, to advancing the public's general awareness of the direct care workforce. Our work has begun, but for sure not done. We are advocates for improving compensation and benefits, training and career advancement, and publicly recognizing the significant value of the direct care workforce in all of the healthcare sectors. It's an essential. It is the backbone of our healthcare system. So again, we've done amazing work. I think the depth and diversity of today's agenda really reflects that. But going into 2023, we've still got important work to do. It continues to be our vision that consumers are receiving high quality support and care from a strong workforce of skilled and qualified direct care workers who are well compensated, well trained, well respected, and have opportunities for advancement. We have highly sought after jobs. People are going to begin coming to us looking for satisfying work. And that is the next step that we're going to eagerly look forward to in 2023. Brooke, if you could just share the slide identifying our leadership team. We've often talked about the 3 or the 4 legs of our strong collaborative bench. And without the dedication, the creative, innovative thinking, and the diligence of the members that are on the leadership team, we would not be where we are today. So let's begin recognizing the people that are really leading boots on the ground activity. Hope Carwile and Pascal Adu have tirelessly built a value and awareness team that is making not only strong statements within our state, but because of the work of Jennifer Oakes and others, we are getting recognized on the national level. So thank you. Andrea Kuwick and Deborah Lively have the awesome responsibility to lead us toward improved understanding of the complicated arena of compensation and benefits, and where that will take us in 2023 in important steps for advocacy. Remember, one of our goals is well compensated. So we're not going to lose track of that. Now coming to the training and career advancement. Please let me use this as an opportunity to recognize the consistent diligence that Lauren Chevalier has brought to the work of the collaborative since the very beginning. Lauren will continue his work as a collaborative resource directly linked to the standardized curriculum, but Lauren is now handing over his co-chair role of the training and career advancement team to our new team leadership team member, to Joseph Valdez. And Joseph and Chrissy Esposito will continue to work for the training and career advancement and be dedicatedly involved in the development of the standardized curriculum. So Lauren, thank you for your service. We know you're not far away, only a phone call. We look forward to your continuing expertise in supporting the standardized curriculum development. And Joseph, welcome. You are joining an awesome group. Brooke, introduce us to our Strength the Workforce team at HCPF.
Perfect. Thank you so much, Penny. I would just like to echo Penny's sentiments. Thank you, Lauren. Welcome, Joseph. And on the screen, you will see our HCPF workforce team led by Candace Bailey, Division Director at the Community Living Office, HCBS Division Director. And then our workforce unit supervisor, Heather Johnson. And then you'll see my name, Sam Hall, Jennifer Blair, Tammy Kim Mander, and John Hendricks. If you haven't had the pleasure of meeting these team members yet, you will through the action groups and through eventual collaborative presentations as their ARPA projects get off the ground. So we are so happy to be here in this space and to have the time and the ability to work focused solely on direct care workers, recruitment and retention. So let me get us going here. The rest of our agenda, at this point, I am going to hand off to our first presenter, Kristen Ingstrup from Behavioral Health Administration. She's going to give us a little bit of information about the BHA and their grant opportunities and things that are going on in that space. So Kristen, I will quit sharing and let you take the floor.
Thanks, Brooke. Can everyone see my slides all right?
Yes, we can.
Thumbs up. All right, great. Well, it's a pleasure to be here today. I am Kristen Ingstrup, representing the Behavioral Health Administration. And so I am going to be talking a little bit today about some of the ongoing work and grant opportunities through the Behavioral Health Administration and how we're working on strengthening the behavioral health workforce in Colorado through community partnerships. And so first, I just wanted to give everyone a little background on the BHA's mission, since we're one of the state's newest agencies, official as of this past July. And so our mission is to create a people-first behavioral health system that meets the needs of all people in Colorado. And so we're going to be doing that through multiple ways, but really seeing community partnership and engagement as one of those main ways of doing so. So the reason that the Behavioral Health Administration all came about was the governor had a behavioral health task force and recognized that there were 6 areas that were needed for a strong behavioral health system in Colorado, and we weren't quite hitting the mark. And so while today I'll be focusing on workforce and support as part of this, there's the workforce and support doesn't exist in a silo. It's highly impacted by both whole person care, access to services, affordability, connecting with local and consumer guidance, accountability, and really just needing to create that holistic vision for a behavioral health system. So most recently, the Behavioral Health Administration is pleased to announce $130 million in community gap grant programs that are available for both local governments, nonprofits, community centers, and as you can see here, that there's a very broad array, whether it's focusing on the communities, children, youth, and families, as well as stability grant programs to improve the retention of the substance use disorder workforce, as well as focusing on early intervention, diversion from the criminal justice system. So if you or the organization that you work for are interested in some of these grants, I've put the link below on this slide so that people can explore this further, as this has really been a historic investment in the behavioral health system in Colorado. And so separate from that grant program, I'm going to talk a little bit about Senate Bill 22-181, which was around the behavioral health workforce and sort of why it came into existence, what we're doing around the behavioral health workforce, and where we're hoping to go. So the legislature, when they were developing this bill, what we were hearing through our stakeholder engagement sessions is that there aren't enough providers, there aren't strong enough incentives for recruitment and retention, and that there isn't enough training or regulation. And so that's what the Colorado General Assembly was responding to when they provided $36 million in federal stimulus funding to help strengthen the behavioral health workforce. And so in Senate Bill 22-181, as I mentioned, this is a significant and historic investment in behavioral health across the state. We knew that before COVID, behavioral health was a crisis, and now it's pretty much a house on fire emergency. So in this bill, we're charged to promote the profession, make it more appealing for people to want to be in the behavioral health space, create opportunities to grow in the field and develop along career pathways and pipelines. Building a coalition of peer support specialists who bring their incredible lived experience and expertise to help people on their recovery journey in ways that more clinical teams might not be able to connect with them. And so really understanding this newest sector of the workforce and how we can support them and their growth in a healthy and sustainable way across the state. And most importantly, we hear you when we know that keeping it local is incredibly important, because what works on the Denver metro area is not going to be the same size solution that will work out in Craig. And so really thinking about how the solutions that we're proposing can be fitted for the communities across the state and not just for one particular type of community. And additionally, the Colorado Department of Public Health and Environment has a Colorado loan forgiveness and scholarship program for the higher credentialed fields to basically put professionals in health professional shortage areas and hopefully get them to stay there after their loan forgiveness runs out. So as part of this $36 million, our first priorities is to expand the peer support workforce for reasons that I mentioned previously. We're also going to be working on piloting a behavioral health aid program that's very similar to Alaska's models for those that might be familiar with it. But that model is allows for tiered paraprofessional role. The first tier basically being along a high school diploma, GED level, and with opportunities for learning as you work, and progressing up to 3 tiers, and one that is equivalent to a college bachelor's degree. So that will allow us to really expand the workforce and allow different roles to work at the top of their license, and also giving a really community-centered approach to having someone who is already in the community and helping, and allowing them that pathway to continue helping in a more formalized role. Additionally, we'll be offering pre-licensure stipends and paid internships to those who have graduated from a degree program and are working on those unpaid internships, or working towards licensure, and really giving them those passing through to higher education to allow for those wraparound services. So that way, if someone is having difficulty with childcare or transportation, that their institution will help them succeed into getting their licensure without having those financial difficulties being a blocking area. Additionally, we're going to be offering funding for career pipeline development grants. Like I mentioned, people are already out there in the community doing things well, and so this will be an opportunity to further enhance programs that are already out there or scale them up to diversify and strengthen the workforce, especially acknowledging that in rural areas that can be particularly challenging when you don't have the same type of opportunities as you might in the metro area. We're also, the Colorado Department of Labor and Employment recently launched the first behavioral health apprenticeship programs, and so we are also going to be helping scale those up and provide more incentives for people to enter apprenticeship programs, both at a young age out of high school, but also for those who may not currently be in the workforce but are interested in joining the workforce and having a earn as you learn type of experience. One thing that I'm really excited to share is we're developing a learning management system and learning more, but more than that, a broader learning community for behavioral health providers and other roles. This will be launched this June, by June 30th, and our first trainings will be around children, youth, and family in crisis, as well as cultural responsiveness, both like foundational topics as well as clinical topics. There will be, as you can see here, this is a multi-million-dollar project, and we're also hoping that this can be someplace that is free for everyone in Colorado and can help people on their learning journey and create better care for all Coloradans. So we'll be developing additional training on the bifurcation of mental health and substance use, increasing criminal justice competency and responsiveness to people in those populations, working on trauma-informed care, as well as things like how do we do telehealth well, or children, youth, and family content that helps dig into the specifics of those populations. So we're really excited to be able to launch that this year, and I'm sure we'll be announcing that in the HCPF newsletter too, to make people aware of this free learning community. Additionally, acknowledging that retention and recruitment continues to be a challenge in the field. We're going to be having a small grant program for employers to apply for innovative retention and recruitment strategies. So giving them the opportunity to say, hey, I have done this engagement with my employees, this is what I'm hearing from them about what is needed or what would be helpful. You know, it can be anywhere from, you know, one-time salary increases, having a massage session after work for people to relax further, or, you know, setting up more mindfulness or yoga practices. We're really looking for people to connect with their employees and figure out what they need, and hopefully apply these funds to helping make their work a better place to be. Our last priorities are around community engagement and outreach. And so really, you know, connecting with communities that have historically been ignored or excluded from the workforce, and really making sure that people see behavioral health as a viable career and something that they're interested in and can see themselves in. And additionally, focusing on high need job families and thinking through like where the area of where there's the greatest gulf in between supply and demand in the state. Additionally, we're going to be doing behavioral health workforce development research, data analysis, and policy development to make sure that legislatively what the structures that we have in place will help support the profession going forward, and making sure that we're reducing barriers for people to enter the workforce. So that's my little spiel on how we're trying to improve and strengthen the behavioral health workforce. And I encourage everyone who's interested to sign up for our newsletter. It has a lot of good details about both funding opportunities available, as well as the most recent news in the state around behavioral health. So thank you all for having me here today. It's been a pleasure, and I'm looking forward to the rest of the meeting.
Perfect. Thank you, Kristen. And we did have a couple questions come in. So along around slide 6, when you were talking about the Senate bill, Peter Pike asked if these topics are the focus of the grant solicitations.
So yes, and so the topics I had on slide 6 were more the broad like 1,000-foot view of what that legislation contained. And so the individual priorities 1 through 9, I believe there are 5 or 6 grant opportunities contained in there. Like I mentioned, one about retention and recruitment, another one about diversifying the workforce and creating a stronger pipeline. So where those retention and recruitment grants I mentioned will be opened at the end of January, and that will be announced in the BHA newsletter, and so organizations can best be made aware of grant opportunities and workforce initiatives through the newsletter. I'll also put a link in the chat to our workforce report that was issued in September that really lays out how we're going to be approaching the Senate Bill 22-181 funding. And so that gives a little bit more detail for those who are interested as to where we're going, what we've been considering. And yes, local workforce areas are able to apply for these grants. And Elizabeth, that's a great question about training for providers who are not currently serving Medicaid on how to, because that's one of the topics that we're very interested in having in this first, not in the first initial launch, but developing as we go on, like how do I become a Medicaid provider? Because we definitely recognize that Medicaid providers are the core backbone in serving those who are in the most vulnerable communities. And so we definitely want to reduce any sort of barrier to entry, whether it's knowledge, whether it's administrative. And so that will be part of the training that we'll be developing for the LMS. And if you guys want to reach out to me, I can put my email in the chat, and I will also share a link to sign up for the BHA newsletter.
Perfect. Thank you, Kristen. All right. If there's any more questions for Kristen, will you be here for a few minutes in case messages come through the chat? All right.
Yes,
perfect.
I'm planning on staying for the rest of the session. So looking forward to hearing what you all are talking about.
Perfect. Thank you. All right. I'm going to go ahead and get my screen pulled back up here and take us through the next agenda item. All right. And I think it shows you, there we go. All right. So next up, we are going to move right into our next presenter, which is going to be Kate and Aaron from Government Performance Solutions. So I'm going to move to their first slide and welcome them.
Great. Thanks so much, Brooke. And thanks everyone for having us. We're really excited to be here. So I'm going to go through a few slides, and then we're hoping to use the bulk of our time with you to really be kind of having a collaborative discussion. We have a tool that we'll be introducing to you all so that hopefully we can get some ideas and engagement from you all and your expertise around some of the topics that we're going to be talking about. So Brooke, if you go to the next slide, that'd be great. So just really quickly, in terms of an introduction, thought it would probably be helpful for you all to know who we are. My name is Erin Ulrich. I'm joined by my colleague, Kate Newberg. We are both consultants with a group called Government Performance Solutions. So we are a small management consulting firm based in Denver. We work exclusively with public sector and nonprofit organizations, so we're really focused on working with mission-driven organizations to expand impact in whatever space they're working in. So really excited again to be partnering with HCPF on this project and having an opportunity to get some expertise from you all as well as we go through this process. Next slide. All right, so in terms of the project objective, I think you all have been introduced to this project already, so we're, again, not going to spend too much time on it, but please feel free to come off mute and ask questions. Or if you want to put questions in the chat, we're happy to hear those as well. The objective around this project is to really use research to develop recommendations for innovative and impactful practices to support the direct care and case management workforces and obtain stakeholder feedback from the workforces. So again, we're really looking at, what's happening in Colorado already? Where do we have kind of some momentum and traction that we might want to build on? What's happening in other states around this that has really been impactful that we might be able to replicate here in Colorado? And then having conversations with those of you who are delivering these services, who are working for agencies, to really kind of hash through, what are those things that we should be digging deeper into? So in terms of the project, that was actually perfect. Beautiful timing. In terms of the project approach, we have done a lot of research in terms of looking at websites, reading reports on national best practices, really digging into state websites. We've had a couple of interviews as well, which is kind of the deeper dive, which is that third section. But we are really wanting to dig into again, there's tons of practices that are happening across the nation around strengthening the direct care workforce. And it's hard, we can't dig into every single topic in enough detail to really provide actionable guidance. And so we identified 4 topic areas that we're going to be digging into collaboratively with HCPF, and we can identify more today, and I'll get to that later as well. But really, again, focusing on Colorado as a leader in the direct care workforce. I think the work you all do, I think it's been great to kind of hear some of the introductions today. And we've kind of been oriented to it, is really incredible. The work that HCPF is doing is very progressive in terms of many of the other states that we've spoken with said, well, you should talk to Colorado. Yes, we're working with Colorado. So, there's a lot of great things that are happening. There's also, some topics really digging into, particularly around peer mentoring. That was an interest of something that we might be able to do statewide in Colorado. Workforce housing. So it's not, looking at those wraparound supports. What are some of those barriers to getting folks into this workforce and keeping them in the workforce? And tiered pay tied to skills, experience, and competencies. I want to pause just for a second here, just to provide the context that we have had the conversation many a time around just the level of compensation, right? We all know that like the ideal strategy is to pay people a thriving wage. I think that's a goal of HCPF's, that's a goal of ours. And there's a lot of things that we can do in the interim to really kind of prop up the system and make sure that we're kind of making it as impactful as it can be given the constraints that we have today. So I just want to caveat, all of these topics we think are incredibly important, and we know they're not the most important strategy that we should focus on ultimately. So both of these will happen in parallel, and hopefully one can happen before the other. And then again, so sorry, I'm talking in circles a little bit. The slide is circling. In terms of the research approach, again, we've kind of researched all of the states and have a lot of this list of practices. We've narrowed it down to a few that we want to really dig into and get more information on. And when we do that, we're going to be interviewing states. We've had, again, a couple of interviews already, and then we're also going to be engaging those who are working in this space. So this is one of those meetings. We've met with the Healthcare Workforce Strategy Group as well. We're also going to be meeting with the Direct Care Workforce Compensation and Benefits Action Group, as well as with case managers later on in this process. So we're kind of zigzagging between this, the third column and the fourth column, making sure that, what we learned today, we make sure we ask more questions when we're doing those state interviews. And what we learned from state interviews is included in kind of what we're sharing out today. So that will continue to weave that together. But again, we're really excited to get input from you all on how to make this the most relevant to you, right? You all can read national reports. We could provide a really canned report that says, here's the 5 things you should do and the 10 steps. But we really want to tailor that to like, where is Colorado at? What have we already learned here? How do we make this more specific so that it's actually useful to be able to move forward and take some action steps? So we have a final report that's going to be due in the middle of April. And then again, there's many steps between now and then. So hopefully we'll have lots of engagement with this group today. And then depending on kind of how this all fleshes out and how things are coming together, would love to re-engage this group in the future as well. So I'm going to pause there just to see if there's any kind of overarching questions about the process. I see a couple of things coming through in chat, but want to make sure there's nothing for us. Great. All right. Well, then you can go to the next slide and I will talk us through kind of what we're going to do today. And then I'll pass it over to my colleague, Kate, who will guide us through the activity. So what we wanted to really talk through with you all today is the 3 topic areas that we really wanted to dig into, as well as the tiered compensation. So those are things that we really want to get your feedback and your input on. And then we also want to understand what's missing from that list, right? What should we be concentrating on that we're not? So, it's like going to be the game changer and direct care workforce strengthening coming forward. So we want to hear if there's something we left off, but also really want to dig into those 3 topics. And we have a number of questions on this board, really looking at, what's the impact and feasibility of these from your vantage point? So if we could prioritize one, which would it be? Which ones do you think are the most feasible that we could actually kind of get through? What are some of the barriers or anticipated negative consequences of any of the above strategies, right? We all know that even if we think we're doing something great, it might impact something else that we didn't think about. So we really want to use your expertise again to be thinking about kind of what are those unintended consequences that could potentially be happening. And then we also, again, are going to be doing additional research. So we're going to be doing more interviews and really looking at potential models.
And Erin, I'm sorry to interrupt you, but I think we're having a little bit of audio issues.
So want to know,
Let me see if I can get, let's see.
Erin, I don't know if you can hear us. I'll go ahead and take over. You were kind of cutting out in and out there at the end.
Yeah, you want to take over, Kate? Yeah.
Sure. Yeah. So she's pretty much done as far as going through stuff, but we really want, again, your candid feedback as far as these topics. We'll be dropping a link in, and Jennifer just dropped it in so that you'll be able to actually see the board. So now's a good time for me to kind of show you how to navigate the board. When you click that link, it will open on a new browser. Sometimes it opens behind your Zoom window if you're in full screen. So if you don't see it, you might need to minimize your Zoom window. But also the other thing with this, we encourage you to use a bookmark to save this link in your browser. Brooke will be sending this out with all the materials too, but we will leave this open. So don't feel kind of compelled, like there's too much information here. I can't process this and provide feedback. It will be left open. We just wanted to get you familiar with the board, show you how to use it, get some initial kind of ideas and dialogue going. And then with that, feel free to share it with your coworkers, or if there's other individuals who are typically part of the collaborative that aren't here today, encourage them to go in here and add their thoughts as well. So real quick for navigation, it depends on where you kind of land when you open it up. It's never the same, which I haven't figured that piece out yet. But in the lower right corner of the screen, I don't know if you can see my cursor, there is a zoom button. So you can zoom in if you need to read something. You can zoom out if you're like, where am I on the board? If you want a big overview of the board, this little arrow is a mini map. If you click that, it'll show kind of, oh, there's a bunch of stuff over here. I might be over here. I see I'm near a gray box. That's another way to kind of navigate. And then as far as adding questions, the easiest way is if you just double click your mouse, a new sticky note will be created. So feel free, if you're already in there, go ahead and click, do a little test note for yourself. Make sure you're able to access it, that it works. I'm also going to turn off my show cursors. So, and then when you are writing, you'll notice there's kind of your typical Word toolbar. So if you want to really emphasize a word, you can highlight it, bold it. If you've realized, oh, I made a mistake, or I don't really want to say that. If you just click the delete button, it deletes. If you happen to be trying to move someone else's note and you accidentally delete it, that's okay. Just do Control and V and it will bring it, Control and Z, I'm sorry. I just deleted that. So that was a bad demo. But if you immediately do Control Z, it'll bring it back. So just to say that. And is everyone able to get into the board? And if you're not, feel free to pop off mute. Also, if you're having trouble like actually creating a note, depending on, if you're on your phone, for example, I know you can't access it, but it's not super user friendly. You can pop off mute, share your ideas with us, or if you want, just drop them into the chat in the Zoom window. And we are happy to cut and paste that into the board for you until you can access this. So real quick, before I kind of jump in and go through the questions, is there any questions about navigation, adding a note? And then also one other thing, if you need to move around on the board, besides using the zoom in, zoom out, if you right click your mouse, you'll notice the arrow turns into a little hand. That allows you to pull the board so you can scroll it back and forth and up and down. So that's the other way you can kind of navigate around the board as well. All right, well, I'm going to zoom in here and just share the questions out loud and then give you some quiet time to go ahead and answer these. So the first set of questions, as Erin said, is really, we want to know what you think the impact or feasibility of the 3 ideas that are listed on the board. So the peer mentoring, workforce housing, tiered compensation, and then other benefits or strategies. So we just gave some examples. And again, that's listed there because there are things we may have completely missed. So if there's things that you're like, oh, you should look at apprenticeships, for example, go ahead and make a note about that. But anyways, back to the questions. So of those items above, which one do you think is the most important and why? Which one do you think is the most feasible and why? And again, if you don't know, if you're like, I have no idea what's feasible or not feasible, that's fine. If you do, great. If you don't feel compelled that you absolutely have to answer any given question. And then other than what the state is already pursuing, and what we have listed here, are there other benefits or strategies that you think we should research or look into a little more? And then along with that, the 3 we have above, are there any strategies that you think, that's not really a great idea? So when you're writing your notes, go ahead and just reference which question you're answering. So you put like the number 1 before, or if it's question 4, the number 4 before, just so as we're looking through these, once kind of everyone's had a chance and board's been open for a while, we can kind of align and know which you're referencing there. But try to be as specific as possible while being concise. So we provided a few examples in there to kind of guide your responses. And with that, it looks like some people are already typing. So I will be quiet at this point and give you a few minutes to jot down some thoughts, and then we'll just go over the next set of questions before we run out of time. And then, like I said, this board will stay open, so please feel free to bookmark it, or it will also be sent out as a link with all the materials. So feel free to come in and look at those materials later.
Awesome. Thanks, Kate. And I just want to reiterate, if everyone can hear me okay, hopefully, that this is really meant to be a helpful tool for engagement to get like a lot of people's thoughts and expertise quickly. If it's not working for you, please, please, please come off mute, use the chat. I see we have about 27 or 8 people in the board. And I think we've got over 70 on the call. So if you're not able to use the board, please use the chat or come off mute or otherwise participate. We'd really love to get kind of expertise from everybody that's on this call. Thanks, everyone.
And also, I just want to kind of reiterate what Erin mentioned earlier. We totally get the idea of paying people a living wage. That's not off the table. That is something that the department is pursuing. It just will take a little bit of time. So kind of the interim piece is, these are the additional supports or additional ideas that can help support the workforce. It's not instead of. Right, it looks like those of you that are in the board seem to have a hang of it, so I'm just gonna zoom back in and just cover the next set of questions. So again, feel free to answer the questions in any order you want, or answer one question, or answer as many as you want. So the next set of questions in the kind of darker yellow is really asking about, in addition to the states we've mentioned, so Michigan, Washington, Oregon, Minnesota, and then organizations like PHI and CDOT, who else would you recommend that we reach out to and speak with? And if possible, can you, looking at, let me zoom in a little further, the example here, what kind of strategy you want us to ask them about? So who the organization is, and then the name of the person, and if you have their contact, that will just help us reach out. If it's kind of a generic thing, it makes it more difficult for us to know who it is that we should be reaching out to, or what the strategy is. And then as we're interviewing other states, are there some specific questions that you want us to be asking? So again, it looks like someone, another example would just be, maybe how are other states developing their tiered compensation while maintaining scope of practice? So anything that, again, that states might be able to answer that you think we should be asking or digging into, feel free to add that information. Let's zoom back. And then just real quick, if you have comments or questions that you're like, oh, I don't think it really fits under any of those categories, we do want to collect that feedback as well. So we do have a section called other comments or questions. So again, if you have feedback that, or if you feel we've missed something entirely, please feel free to add that. We've got that space for that as well. And for those of you that are dropping ideas or comments into the chat, I am cutting and pasting those onto the board for you. All right, so you've got a few minutes left before I'll hand it back to Brooke. I know there's a lot more on your agenda. Again, feel free to share this with coworkers, other direct care workers, other people on the who would have an interest or comments on this. And then if for some reason you can't access the board or you're having any issues, as part of the materials Brooke is sending out, both Erin and my contact is in there. So also feel free to just email us directly and we can add this into the board. Part of the reason we're using the board is that way people can kind of look at what others are saying, and some of you are already doing that. Like, I love that idea, adding those sorts of comments, or I second that. That just helps us again, once we're kind of looking through this, just have a better understanding of what's all important to all of you. So anything to add in closing, Erin?
I don't think so. Just really appreciate the feedback from you all. So please keep it coming to the extent that you can. I know you all have a lot going on, but if you can, keep inputting in the board during this meeting, send it out to your colleagues and coworkers. The more input we get, the better this research is going to be, and the more tailored it will be to Colorado, and hopefully the more impactful it will be. So just really appreciate you all taking the time today. Thanks so much.
Thank you.
All right, perfect. Thank you both so much. I am going to throw your email and contact information up on the screen just really shortly, just so folks can jot it down if they need to. Let me swap my view there. And just for those of you that are interested, Erin and Kate will be continuing to engage the Compensation and Benefits Action Group, which will be meeting in January on the 20th. And then hopefully, kind of depending on when those final reports are due and what they find, we'll continue to invite them back to the collaborative as well to share what they're finding, and just kind of keep y'all informed, since you were kind of part of this, like, let's dig in. We'll just kind of keep you abreast of the situation and the information that they're finding moving forward. So as Kate said, this information will go out and be posted to the website. So if you don't get their email address here, don't worry, you'll get it at some point. You can always reach out to the HCPF team too if you'd like to be connected with them. So thank you both so much. And like they said, that note board will be open for a while. So please access it as you wish. So, all right. So moving into our action group spotlight, I'm really excited to share with you all that the Value and Awareness Action Group has been working on their story sharing blog. If you have been to any of the action group meetings for Value and Awareness, you know that this is something that they have been working on for a couple of months now, back to summer actually. And it from the ground up, essentially, what kind of platform do we want to use? How do we collect stories? How do we engage people? How do we share this information? And so that blog is now live. One of my team members should be dropping the link in the chat shortly for you to access it yourself. It is, it's a blog, and one of our dedicated action group members, Jennifer Oakes, has been checking the email and posting these stories as they come in. And so basically what we're doing is we have an email address set up for folks to share these stories. You can be a direct care worker sharing your story. You can be an individual receiving services sharing your story. You can be a family member. You can be someone that works in the field and has had to work alongside direct care workers. But essentially, we are collecting stories to help people understand the full breadth of all the things that direct care workers do on a daily basis, how integral they are in our community, and how important it is to keep supporting them and making sure that we're taking care of them and getting them into the field, keeping them in the field, and just taking care of them. So the link is in the chat. Heather just dropped it. So I would be sure to bookmark it, because hopefully we'll just have tons of stories pouring in. These are just a few screenshots from the blog. And this, on the next slide, is a beautiful flyer that one of our other action group individuals created for us. Madeline Landgren put this together for us. And essentially she, did some leading questions for folks. So if you want to share your story, but you're not really sure where to start, she gave kind of some questions to start out with. She has the email address on how to share these stories, and then you can go back and read the stories at the blog. So we are super excited about this. I see that I have one of the co-chairs, Pascal Adu, is here, and also Jennifer Oakes, who has been integral in getting this story sharing blog up and running. And I wanted to give them a few minutes if you would like to say something. If not, that's okay. I don't want to put you on the spot, but just know that both of you have been integral in this, and I want you to share anything you'd like to say about the blog or the process to get it here. And I promise not to put you on the spot ever again.
This is Jen Oaks. I just wish you guys would send this flyer to everyone. Spread the word because we need more stories.
Absolutely. And I think what I'll do, Jen, that's a great idea, is after this meeting, if you all are okay with it, I will share this flyer in, Madeline gave us a PDF, a JPEG, and I think a PNG file. So anywhere that you can share it or any way that you can share it, I'll send that out to everybody on the listserv today. And you can put it on your social media pages, put it in with your folks that you're working. I think Tara Goldsby was going to put it in with their Christmas cards. I mean, just to start sharing the word. The general public know what a direct care worker is. So Lynn, we've gone back and forth on all the different titles that direct care workers go on. It's all encompassing, lots of different titles, lots of different things that they're doing. And so we did, as a group, Value and Awareness and the leadership team, come up with a definition, I guess, of sorts on what we thought a direct care worker would be. And that lines the very top of the blog. And so the screenshot on the left there kind of says that we want to recognize and raise awareness. And then we talk about what we feel like direct care workers are. Paid workers whose primary job responsibility is to provide care and assistance with activities of daily living to support elders and individuals with varying abilities, needs for safety and wellness, connection, independence, and meaningful life. And so very, very broad, but at the same time, so is everything that a direct care worker does. So if you certainly have feedback on that, we'd love to hear it. But yeah, let's get the flyer out there. I will share the flyer to everybody on the call today. And let's make Jen so busy posting stories that she needs to reach out and ask for help. So yeah, we'll share that. Any questions on the blog or any issues accessing it? Perfect. All right. Well, I'll make sure everybody has access to the flyer as well as the blog. And yeah, bookmark it and let's get some stories going and really push this out, because a lot of work, a lot of thought has gone into it, and we're excited to really start showcasing all the great work that our direct care workers do. All right. So at this point, I would like to hand it off to our last presenter, and we may have more than one, but I'll give it to Jessica, and I'll quit sharing, Jessica, so you can share.
Great, thanks, Brooke. All right, so hopefully everyone can see my screen. Thank you so much for having me. My name is Jessica Corral, and I am the contract specialist with the Participant Directed Programs Unit. I'm here with Ashley Weber, and we're here to share with you a little bit more about the Participant Directed Programs Policy Collaborative. We'll call it PDPPC for short because it's a long one. And for those of you who are not familiar with Participant Directed Programs, essentially our unit manages two benefits: the Consumer-Directed Attendant Support Services, CDAS, and In-Home Support Services, IHSS. And these benefits allow individuals on waivers to essentially direct and manage their in-home care with a great deal of freedom and choice, especially as it relates to recruiting and managing their direct care workers. We call them attendants. Sometimes we throw in caregiver. So all those terms are interchangeable. And I'll let Ashley take this slide.
And Ashley, I'm not sure we can hear you. Looks like she's...
Oh, yeah, we might be having some technical difficulties. Give it a second. I know we're pressed on time, so I might just jump in here. Ashley, I'll go ahead and take this one. So essentially, the PDPPC is a monthly stakeholder group that comes together through Zoom. It was previously in person prior to the pandemic. And it's really a space and a time for all stakeholders within the context and the purview of participant-directed programs to discuss policy, some operational changes, and really have good conversations around how these benefits are being managed and what may need to change. It is stakeholder-led. That is at the heart of PDPPC, and that is done by the leadership of 2 co-chairs. And we really, as a department, ask and encourage people for active participation in this meeting. So a lot of discussion, a lot of work outside of this group, and participation, especially in our formal recommendation process, which I can speak to later. Our stakeholders are varied, so they include self-directed members themselves, individuals on these programs, CDAS and IHSS. They often use the support of authorized representatives, their caregivers, attendants, relatives in their family or friends, neighbors, IHSS agencies, case managers, advocates. A great number of individuals come to these meetings and participate. And this meeting has been valuable for you all in helping to inform the structure of the Direct Care Workforce Collaborative. And Brooke and her team have used some of what we've done in PDPPC to inform the work that you guys are doing. So we've been happy to share some best practices and key insights in that way. It's had a long history and a really significant impact. It started in 2001 with our state disability community. At that time, they were expressing many concerns with the department just about how policy decisions were being made, and especially being made often without stakeholder participation. So with our work to partner with this community, we created PDPPC. And this, again, is really in an effort to hold an equitable space and time for really thoughtful, intentional policy development. The progress that we've made over these last 20 plus years has been really valuable. There are power dynamics in play in a group as varied as PDPPC. And again, that's helped to be balanced by our co-chairs who are self-directed members themselves. We have a formal voting structure in which the state does not have a vote in that process, but we do participate very intensely on creating those recommendations and implementing them. We have that recommendation process, and then we participate and hold work groups and breakout rooms. And we have been able to have about 100 attendants on average over these last many years. It ebbs and flows, as I'm sure you guys have noticed in your own meeting, but we are really pleased to be able to say that people have remained engaged with PDPPC. So this is a flow chart of our recommendation process. I will not speak to each of the steps. This will be available on the PDPPC website in about a week. So anyone interested can check that out if you'd like to read it more closely. But essentially, it starts out with an issue being raised in PDPPC by a stakeholder. If other stakeholders agree that this is a important issue to explore, to research for possible policy or operational changes, then a motion is the motion process is used to move that discussion into formal work to create a recommendation. And that's a written recommendation. There's a form attached to that. A lot of that work is done outside of PDPPC through work groups or surveys, different methods. Once that recommendation has been drafted by stakeholders, then it's brought back to PDPPC for a formal vote. If it's voted in the affirmative, then it's sent on to the department, and we have 20 days to provide a formal response about whether the recommendation is possible or not. If it is, or if it's not, we still present at PDPPC, but if it is possible, then we go back to the formal vote process. And if it's voted in the affirmative, again, we get to work right away to implement those changes. If it's not, we keep working with those stakeholders to answer questions and make refinements to that recommendation. I'll say that we haven't had many formal recommendations come through in PDPPC in the last couple of years, but one significant one did relate to the background check process for our CDOS program. So essentially, we were hearing from stakeholders at around fall, summer 2020, that the background check policy for CDOS members was pretty strict, and it was getting in the way of individuals being able to hire needed caregivers. The policy has various different pieces, but a central piece is a list of crimes that prevent a person from being hired as a caregiver. And so in 2020, we went through the process to have that issue raised through PDPPC. That led to a work group being created. And up until about spring of 2021, the work group did a lot of research, had a lot of discussion. There was great participation to relook, especially at that list of crimes, the barrier crimes list, and make some changes to it. We presented that to PDPPC, and the group voted to adopt those changes. And so that was done in spring of 2021. We had some other work that we wanted to get done, but unfortunately at that point, it had been several months of really dedicated efforts by this work group. We did lose some participation from particularly CDOS members. And so we made the intentional decision to shut down the work group at that point, to be able to do some more research within the department and present some of the other work to the stakeholder group so that we could revive the work group at some point. And that was done in January of this year. We worked very closely with Ashley and others to look more closely at the barrier crimes list again. We actually renamed it, as well as the process to give members a little bit more choice and autonomy in making final hiring decisions. And so that recommendation was drafted and voted in the affirmative by stakeholders in June, and the department has worked since then to really operationalize those changes. To get a little bit more specific on what the changes were and the successes of those changes, we have this slide. And Ashley, I don't know if you're able to come off mute now.
I'll do a test.
Oh, we can hear you. Wonderful.
Okay, so the outcome of the work group, it was a great work group. The challenges, that we had in hiring attendants and caregivers for what we needed, it was difficult and it was inconsistent, and it contradicted, a lot of self-direction and the freedom that the clients and would have in hiring caregivers for whom they would like to work in their house. So this impacted a lot of the members who were on CDOS, and they weren't able to meet the needs that they had at their house. So the challenges were also not responsive to current stakeholder experiences, which Jessica said we ended up having a lot of, once it was revived, we had a lot of success with people coming in and talking about the different challenges, and the success that came from all of the people coming together in the stakeholders group and the work group was we provided more support and education, and we had more centers for the policy and process for the members' choice to make that decision. And it ensures the proper oversight that we now can hire who the attendants would like to hire without having to go through all of those barrier crimes. And in doing so, this would increase availability of attendants and also able to hire outside of what we were able to before. And this the stakeholders engagement process utilized this process, and we were able to to pass this. And I believe that this was one of the most successful ones that we've had. We haven't had too many, like Jessica said, but hopefully we'll have more and can move this program forward in the future.
So that's the information we really wanted to impart today. We have the PDPPC website where any of you can visit to learn more about PDPPC. Those recommendations that come through get posted to the website, so you'd be able to read the background check recommendations specifically. And then there's more information about when PDPPC occurs. As I mentioned, that recommendation flow chart will be posted to that site very soon. You can also reach out to the Participant Directed Programs Unit if you have more questions about CDAS or IHSS, and that email is hicpuff_pdp@state.co.us. And we really just, in addition to wanting to share more about how PDPPC runs and specifically how stakeholders participate in making policy change, really just want to say we've been working diligently to create a connection between PDPPC stakeholders and you all, the Direct Care Workforce Collaborative Stakeholder Group, because we know that this issue of a workforce crisis and not having enough caregivers to provide these really critical services extends across all kinds of services and benefits. And so partnering together has been really valuable, and we continue to do a lot of work to see how we can bring more people to the table and have our work be effective. So thank you for your time. I know we have a few more minutes for questions.
Absolutely. Thank you, Jessica. I haven't seen many come through the chat, but certainly let's just give folks a minute to ask questions about the process, about PDPPC in general. Absolutely. And if nothing comes through, we'll go ahead and move into the next portion of our presentation.
Great. And thank you, Heather, for putting the link and the email in the chat.
Awesome. Thank you, Jessica. Thank you, Ashley.
Thanks so much.
All right, let me get this pulled back up for us here. Do a little screen shifting. All right, so next, speaking of things that we have taken from PDPPC, we have implemented the last couple of collaboratives, what we call the open forum. This came to us through one of our feedback surveys as well. Someone said, hey, we'd like a little more time to chat just as a group and share resources, share struggles, that kind of thing. And PDPPC does that in their meetings as well. So we are going to move into our open forum. Our open forum is open to any of our attendees that are here. We ask that you raise your hand or put in the chat if you'd like to talk, and then come off mute. Share any upcoming events for your agency, anything that you're seeing that you'd like to share with the group, any questions you'd like to ask, get feedback on. This is your time, and we would like to welcome anyone here in attendance to share at this time. And Melissa, I see that you have raised your hand. Please go ahead.
Hi there. My name is Melissa Benjamin, and I am a former home care worker of 20 years. And now I help kind of move and run an organization known as Colorado Care Workers Unite. And all these issues in the stakeholder groups that get discussed are very important to us. And care workers themselves are very important to us. We are a big coalition of home care workers that have come together to raise standards in this industry for people who provide and people who need care. And so I just ask anybody on the call, if you're interested in what our organization does, please feel free to reach out to me. My number is 303-589-8629, or you can just Google Colorado Care Workers Unite and get directed that way. Right now, we're working on a home care worker like Bill of Rights, where we're just trying to pull together as much community support as we can for it. And really what care workers in this state want to see is, one, the ability to make a livable wage, like adequate benefits, work in an environment free and from harm, that's safe and free from harm, work in an environment that's free from like discrimination and bad bosses, and to have some decision-making power in the industry, because there are a lot of workers in this state that have done this work for a long time. And just as clients do too, they know how to, they know what this industry needs, right? And so we're organizing to not just get people to have a voice at the table, but to have home care workers be able to make decisions in how their industry is ran, right? So if you want, and we have a petition for the Home Care Worker Bill of Rights right now. It is on our website, and then and it's now in the chat. If you want to go ahead and sign on to that. And basically it's a petition, and the more names that are on it will really prove to people in high level decision making spaces that the people of Colorado really care about care work, being able to access care work, and being able to provide and receive quality care. And I know there's a lot of people on this call that are doing everything they can, and it's a really tough industry to fix. There's a lot of funding issues that make it hard for people who want to address this industry, that get in the way of being able to address it. So I'm just appreciate a space where we can all come together and try to work together to kind of to change those things and fix this industry. So thank you. Home Care Worker Bill of Rights in the chat. And Colorado Care Workers Unite is an organization of care workers that is seeking to improve this industry. Thanks.
Awesome. Thank you, Melissa. Thank you so much for the work that you do as well. Joe, I see your hand up. Go ahead.
Hi, my name is Joe Urban. I'm the facilitator for the UCCS, University of Colorado, Colorado Springs Professional Advancement Certificate in Gerontology. It's an opportunity for folks who are already working in the field, direct care workers, actually anybody that works with older adults in Colorado, to be able to advance their skills. We have a broad range of topics we go through. It's a 1-year course, 2-semester course, and you can start spring or fall to complete that course. If you want more information, I would encourage you to look at UCCS Professional Advancement Certificate in Gerontology, and our website will have full information.
Perfect. And you are welcome to drop some links in the chat, Joe, if that's helpful for
Sure.
folks to take a peek at that as well. All right. Looks like we have a couple questions in the chat. We'll let, it looks like Heather's on top of that already. Let's see. I don't see any other hands coming up. Give it just another minute here. Melissa, I see your hand up, but I think that's from before. Perfect. Thank you. Okay. All right. And folks are dropping information in the chat about the Direct Care Worker Bill of Rights, information on CCWU, so be sure to check that out. We'll also upload a chat transcript as well, and send out the links that were shared so you can have access to those in the future. So last call. If there's no other comments or questions for the open forum, I'll go into sharing some resources from the department and other state entities. All right. If you think of something, just raise your hand. All right. Perfect. All right. So we do want to provide some updates on a couple things and resources available to direct care workers and healthcare workers across the state. The first one is Senate Bill 22226, Care Forward Colorado. If you'll remember back in June, we did some legislative bill updates from our HCPF team, and this is one that is moving forward quite quickly. And so the Care Forward Colorado is, let me pull up my thing here, revitalizing Colorado's healthcare workforce through zero cost, short-term training programs at community and technical colleges. So these are training programs that are a year or less. You can learn skills to become certified nursing assistant, emergency services professional, many more professions that are desperately needed in Colorado's healthcare facilities. A lot of these we're thinking are running parallel to the direct care workforce. And so we just wanted to share, we know that our direct care workers are working side by side with CNAs and other medical professionals. So we just want to share this as a resource to get the word out. In addition to, let's see, looks like people are dropping a couple things in the chat. Oh, Heather shared the link for Care Forward Colorado, if you're interested in that. We also have our ARPA grants, and those are grants through the department, not necessarily our workforce unit, though we do have a grant in there, but grants through the department that are open for solicitation, and so you can apply for those grants for things like training costs or technology or there's just, I can't name them all, but there's just a handful of different grants that are open right now from that ARPA funding, that American Rescue Plan Act funding that we have available. So lots of applications that are going, lots of them are on, you know, reoccurring openings. And so you can apply and see if you get awarded and then check back and not, and you can reapply or whatever. So we just have a lot of different things going on in that ARPA grant space that we want to share those resources to see if it's something that fits you as an individual direct care worker or for the agencies as well. And lastly, CDPHE, which is a state entity, is working, it's a grant, Healthcare Workers Recruitment and Re-Engagement Fund. And so the purpose of this is to incentivize and assist employers in the recruitment of different licensed healthcare professionals. For specifically in employment and long-term care, facilities with healthcare professional shortage area designation, which is a designation in and of itself, and then pediatric serving hospitals. So again, not completely directed with direct care workers, but aligning in that medical field in the healthcare crisis that we're having. So what this does is if an employer hires someone and is eligible, they may be eligible for, let's say, if a facility successfully recruits a licensed professional who has left the healthcare industry and will work 20 hours per week or more, so they leave and they come back to work 20 or more hours, for a minimum of 6 months, that facility or that employer may be eligible to receive a one-time payment of $20,000 for each professional re-engaged. And so just kind of looking at that whole healthcare continuum and wanting to support individuals in that way as well, and employers. All right, so that's just a little bit about what's going on in our state and in our ARPA grants. And then I wanted to touch briefly on the myriad of surveys that are occurring in this space right now. Some of you may be on all of these web lists for these surveys. So right now in the direct care space that we know of or that we're related to, we have 3 different surveys that are going out right now. The Staff Stability Survey, which assesses the turnover, the recruitment, the wages, and the length of employment related to the direct care workforce. That pilot has been completed. You may have already completed this survey. And that was put out by National Core Indicators in Advancing States along with HCPF. So that one has been completed and we're awaiting the results for that. But it's also anticipated to run again in March of 2023. In addition to the Staff Stability Survey, we have our Direct Care Worker Survey, and that's coming from Vital Research. That was recently launched. That's a link that we're sharing with direct care workers. You may see it coming from CCWU. You may see it coming from some employers, some advocacy agencies, and that's to assist in strengthening the data infrastructure to better understand the workforce. We want to collect data on direct care worker demographics, compensation, benefits, career advancement, training, job fulfillment, everything. And so you're probably wondering, why all these surveys? Why all this information? We know that direct care workers as a whole, it's a hard group to pin down. There's not a licensing board. There's not a list of all the direct care workers in the field. And so there's not good data. There's not good data for us to really understand this workforce to start implementing strategies for moving forward. So part of our direct care workforce team and those ARPA projects that we've been tasked with is to really get a good foundational knowledge, a good foundational data and infrastructure of what's happening in this space interface, and then learning ways to move forward. So if you're wondering why all the surveys, I promise we're going to use it for good stuff. We're just collecting information at this point because there wasn't a lot of good info before. And then the last one is not necessarily coming from HCPF, but it's related to our ARPA fund or our ARPA grant curriculum survey. So UCCS, University of Colorado Springs, is working with us on standardized core curriculum. And they have a survey, an ongoing survey right now, where they're just collecting data about information and professional experiences, about individuals, direct care workers' access to training and career advancement, for opportunities for training. And they really want to identify some strategies to advance opportunities for direct care workers. And so they're looking at what to include in that standardized core curriculum, what's of an interest, what are people getting access to, what are they not getting access to. So lots of surveys happening, lots of good information, but it can be a little bit confusing if you're getting 3 surveys in your email inbox and they all kind of look similar. So if you have questions about what this one is, can I do this one? Can my direct care worker friend do this one? Please reach out to our HCPF workforce unit email. I'm sure my team will drop that in the chat before the end of the call. If you have questions about what the survey is, who it's for, and if you can share it. Any questions on surveys? I know that's a lot. Oh, perfect. Heather's given us some stats on the direct care worker survey, which is great. All right. Okay, 2 minutes left. Pretty good here. So I just want to take this time to thank you all for coming to this meeting today. We had a ton of great information. Thank you to our presenters. We really were very packed. And so if you missed something or you didn't write it down or whatever, just know that in the next 5 to 7 days, we'll get 5 to 7 business days, we'll get the recording posted to the Direct Care Workforce Collaborative website, along with the slides from this presentation and from each of our presenters. I'll be sending out the flyer for the blog, so please start sharing that as well. And before you go, we just want to drop a couple links in the chat. If you're interested in joining our action groups, our value and awareness, compensation and benefits, or training and career advancement action groups, there's a sign up link for that. You'll sign up, you'll be welcomed, you'll be added to the calendar invites. Those are meetings every 2 months, bi-monthly. You're welcome to drop in to see if it's a good fit for you. We don't anticipate that you'll be at every meeting if you can't make it, but certainly you are welcome if you'd like to check it out. The next collaborative meeting is Wednesday, March 8th, 2023, which is crazy, but it will be here before we know it. Any information about joining the collaborative can be found on our website, or you can always email our HCPF team as well. And last but not least, we have a survey that we'd like to send out to you all. It's a Google form. It'll be open for the foreseeable future. So if you don't get a chance to take it today, just bookmark it and come back to it. This helps us implement things for future collaboratives. If there's presenters you'd like to see, again, like our open forum, that was a suggestion. If there's things you'd like to see for this meeting in the future, please give us some feedback and let us know how we're doing. And with that, thank you all so much. And we will talk to you soon. Have a great holiday. Jen, you let us know if those stories start rolling in and you need help, okay? I hope they do.